we've talked the compression, grip strengthening, the ease of use. So who would you say this is beneficial for?
It sounds, I don't know, it almost like maybe takes away some of the validity from it when I just say everybody. So I think it's important to say everybody, as long as they're not in those extreme categories of things, right? There's a difference between degenerative processes and degradative processes, right? One being a normal wear and tear, the other one being kind of is more of like a disease process. If somebody has, I would say everybody except is probably the easier way to do it. Like the exclusion criteria would be post-surgical patients, meaning post-surgical patients that are still healing. Like those people are going to be under the direct care of a physician, a surgeon, a nurse practitioner, a physician's assistant, a physical therapist, an occupational therapist, a hand therapist. Like they're going to be underneath the care of those people. I don't know that somebody who's in an active healing process from a post-surgical patient, like I don't know that that's going to be the case. Now, soon after that, in kind of that phase 2 of that post-acute phase, I could see how this could be dosed in a certain way, right? Wear it for an hour a day, 2 hours a day, half an hour a day, whatever it may be. I could see it being dosed in the beginning to kind of get them into it. And then at some point, kind of that phase 3, of recovery is kind of like, okay, no restrictions, just go for it, right? I mean, so those patients, so not to say that somebody who's had surgery could never benefit from it, but maybe not directly after that surgical case, because that could be really challenging. So that's one case. Other people have a disease process going on. If there's an infection going on, if you're under the care of a physician who doesn't think that this is appropriate, you can ask. There's nothing wrong with asking. However, like people have to be really careful. My dogs again. People have to be really careful with, exacerbating an ongoing infectious process that's going on. So, like this is, to be very clear, like this is not a cure-all for all things. And so people that are under the care of a physician for very specific things, everybody but those people. Another thing I know we've talked about in some of our meetings, our board meetings as well, and the important pieces too is like, I feel I'd be remiss if I didn't mention that, the purpose of this, if we have somebody who has significant joint breakdown, where they actually have significant malalignment or bad alignment, they have a finger that goes off to the side, right? Because the joint is so broken down. The purpose of this, of the MetaFlex therapy glove, is not to realign. I used the word realign earlier, alignment with the tendons. The purpose of this is not to realign and to stabilize joints. Like that's a very specific, that's not an off-the-shelf kind of thing. That's a very customized thing that should be definitely should be under the care of a very specialized, clinician. But again, other than that, like I think the application is extremely broad. Even somebody, I would even encourage people who don't have ongoing pain or ongoing, swelling issues these are going to be at a price point, I believe, that is probably, God, we see co-pays, for physician services, for cash pays for chiropractors, and, co-pays for physical therapy and occupational therapy visits. We see those co-pays with people who are insured. We see those co-pays going up and up and up. But for very close to, if not less expensive than a co-pay for one visit, to a physical therapist or to cash pay to your chiropractor, is that for that price, people who maybe don't have even a significant issue, like this is about the price of that. This is going to be very necessary. Things like this, medical devices, wellness devices, are going to be that are easily accessible to people at a price point that is less expensive at times than a copay to your physician or to your physical therapist. Not to say that you shouldn't go to those people, but this could be a supplement for that, right? Maybe not, or an adjunct to that. Maybe not a replacement all the time, but definitely a supplement to those things. So, because we're going to need that. Healthcare is getting more expensive. It's very expensive to do business. The cost of healthcare is continuing to rise. Seems like astronomically. Like we're going to need, physicians are getting busier, access is getting more challenging. Physicians are burning out. Clinicians are burning out of all cases because the volume of patients is so high. People are going to need more things that they have access to, again, at an affordable price, at an affordable care. Affordable care doesn't just mean let's do large healthcare system work better. I think that's an important piece of it, but affordable care also, these types, the MetaFlex glove actually falls into that category of affordable care, right? When we talk about better patient outcomes, we talk about better patient experience, we talk about affordable care. Those things are really important, and there's room for this. There's room for things like this. So anyway, that's a little plug for ATS as well, because I think there's a lot more. That's one of the things that gets me excited about ATS and some of the things, with your engineering brain and background, and passion to, I know I've told you this before, but like, the passion that you guys have to change the world. Without sounding too corny or cliche, like it's going to be things like this that do it.